Welcome back to BNC Live. The U.S. has made great strides in HIV treatment, care, and prevention, yet there are still a large number of people who don't know their personal status. I caught up with a research project coordinator at Emory University to discuss the issue. Here's our conversation. Derrius Stephon Carter joins us now. Thank you so much for being with us today. Derrius, before we get into Project Peach, let's talk about the advancements made in HIV/AIDS research and how far we've come since the 80s. I remember there was a time when contracting HIV or AIDS was looked at like a death sentence, and that is not the case today.
Yes, absolutely. We have come so far. I mean, just when we think about advancements in medication, now we have PrEP, which stands for pre-exposure prophylaxis, a daily medication that, if taken as prescribed, can prevent one from testing positive for HIV. We also have an injectable option now. For folks who are adherent to their medication, if they do test positive for HIV, they can reach an undetectable status, which means that they can't transmit HIV to their partner sexually. So I think we've just come so far, and we really just need to celebrate these advancements and know that we can end this epidemic.
It really is extraordinary. So give us an overview of Project Peach and its purpose.
Absolutely. So Project Peach is an HIV prevention study, a behavioral health study, if you will, which basically looks at and tries to better understand the relationship between same-gender loving men and their relationship with PrEP, better understanding their experiences, better understanding stigma that may be associated with PrEP. So Project Peach is really trying to narrow down what are the experiences of folks who are using this medication, and how can we better help folks on this journey and be more adherent to their medication while they believe that it's the best option for them.
And so tell us a little bit more about prevention options for HIV.
Absolutely. So as mentioned earlier, there's PrEP, which stands for pre-exposure prophylaxis. There's also, as we all know, condom use. And then there's a new option as well, which is not so widely distributed at the moment, but there's an injectable PrEP option for folks who do not want to take a daily pill, which is, like I said, PrEP.
And based on your research and experience, what's been the barrier in getting the word out or getting more people interested in taking these preventative steps?
Absolutely. I would definitely say stigma. Stigma is a very valid thing. Medical racism has definitely impacted the way that people perceive healthcare, health services, and that is completely valid. So I understand that, or why that is. I would definitely say, like I said, stigma is the biggest barrier to getting information just out about PrEP, about HIV in general. There's still so much work that we as a community need to do, but I would definitely say that beyond just those barriers, there's still so much growth. Anytime we have any interaction or conversation with folks, we're seeing that people are more open and receptive to having these conversations.
How do people become a part of the project, and what does it mean to participate? What does that look like?
Absolutely. So people can become part of the project by filling out one of our screeners. Essentially, one can go to projectpeachatl.org. That's projectpeachatl.org. And essentially, we have an About Us section. We have a section in which folks can then fill out the screeners to see if they are eligible. Someone from our team will reach out to them and give them a little bit of an overview as to what Project Peach is and get them scheduled. For our participants, essentially what that looks like for them is they would figure out what prevention option works best for them. So if they want to do a daily PrEP option, an on-demand PrEP option, which essentially folks take PrEP based on when they believe that they may be exposed in a sexual environment, And then also talking about STI PEP as well, our doxycycline, which our study counselors will go over in depth about those medications and just talk a little bit about the types of surveys that they do and also how they're compensated. In research, especially here at Emory, we believe that it's important that we work with folks and compensate folks for their time. So participants are compensated. Even as soon as the very first visit, where they receive $125 just for their time and coming in and having a conversation with us. So we really want to make sure that we value folks' time. But yeah, aside from that, like I said, it's a lot of surveys and a lot of conversations just to better understand their experiences.
That's terrific. Let's get into where we are when it comes to HIV in the gay community. Is there a sense of normalcy when it comes to contracting the virus?
Yeah, so when we use the word normalcy, I want to use that in the context of normalizing different statuses. I think more conversations are happening where people are recognizing that everybody has a different sexual health status, and how are we creating conversations and having healthy conversations around those statuses, and making sure that, in the event that one is having an interaction with someone who is living with HIV, that conversation is healthy and fruitful and not one that is damaging or hurtful. So I would definitely say that there's more of a normalcy or more normalcy around having conversations around status, more so than just, folks testing positive for HIV. Because like I said, at its core, we as a community, we as a nation want to end this epidemic.
And that's a great point, because part of ending the epidemic comes with having that open and honest conversation. So how is Project Peach bridging the education gap to get people more access and more information?
Absolutely. So during folks' baseline visit or their very first visit with us, they'll have a conversation with the study counselor. And what the study counselor will do is basically just have a conversation with folks about what they already know about HIV and how, and basically, I don't want to say, what is the word that I want to use? Basically, providing more information around what HIV is and other prevention options. So a very educational space. I think that for folks who are not having regular conversations around HIV, there's so much that you would not know on how to prevent HIV. So we really use that space to inform our participants, and then our participants can inform other people. And it's just a trickle down effect.
And lastly, where can people go to get more information about Project Peach and its resources?
Absolutely. So if you would like to know more about Project Peach or would like to participate, please visit projectpeachatl.org. That's projectpeachatl.org. And again, we have an About Us section. There's a section where you can fill out the screener to see if you're eligible. And again, after filling out that screener, someone from the team will reach out, and then you can set up your very first visit with us. So this is such an exciting time for HIV prevention, as well as folks who are interested in participating.
Well, thank you so much for being with us here on BNC Live and for the truly amazing work that you are doing.
Thank you so much for having me.